Welcome to the deep dive. Today, we're pulling back the curtain on something huge, something really reshaping healthcare as we know it. We've been looking at this big 2024 review about intelligent information systems and how they're changing medical data. So our mission today, let's unpack what these systems actually are, how they're being used right now, and importantly, what challenges we need to tackle to really make healthcare better for you. Okay, let's get into it.
Yeah, absolutely. So these intelligent information systems, or ISA, it's not just about gathering data. That's part one. The real magic is how they transform it. They're using AI, machine learning, data mining, even understanding doctors' notes with natural language processing. The core idea is moving beyond just storing information to actively, processing it, analyzing it, learning from it. It helps make better decisions, spot patterns humans might miss.
Right, so it's like giving healthcare a smart brain. How does that actually play out for us? What does it look like? I mean, look at telemedicine. That's exploded, hasn't it? It
Yeah.
feels like it's really breaking down barriers like where you live or how much money you make doesn't stop you getting care nearly as much. Remote consultations, that sort of thing.
Exactly. That access piece is huge. And it connects directly to things like wearables and remote monitoring. Think about your smartwatch or maybe a glucose monitor. These things are collecting data constantly, heart rate, activity, blood pressure. It gives doctors and you, frankly, a much more complete real-time picture of health. It really empowers you in managing your own condition day to day.
And with all that data pouring in,
Mm.
that's where the AI gets really powerful, right? Especially for diagnosis. I've read about AI analyzing medical images like X-rays or MRIs, and sometimes it's finding things like subtle signs of disease, maybe even better, or at least as well as human experts. That's pretty mind-blowing.
It is, and it's not just diagnosis. AI can analyze massive data sets to suggest personalized treatment plans, tailored specifically to your genetics or lifestyle. Plus, it can even predict things like flu outbreaks by analyzing symptom patterns across a population.
Okay, so better diagnosis, personalized treatment.
Uh-huh.
What about the running of the hospital itself? Does this intelligence help there too?
Oh, definitely. That's another big area. ISIS helps optimize how hospitals run. Think about predicting patient numbers when demand for certain services will peak. This means they can allocate staff, equipment, even beds much more efficiently. The goal is less waiting time for you, a smoother experience overall.
Making the whole system flow better sounds great in theory. But let's talk practicalities. What are the real challenges, the sort of sticking points in getting these advanced systems rolled out everywhere?
Good question. There are definitely hurdles. I'd say two stand out. First, there's staff training. It's absolutely critical. You have these powerful new tools, but healthcare professionals need ongoing training to actually use them effectively. It's a constant learning curve.
Right, the tech is only one part of the equation. You need the people comfortable with it.
Right.
Okay, what's the second big one?
Data protection and privacy. This is paramount. We're talking about incredibly sensitive personal health information. So securing that data, complying with regulations like GDPR in Europe or HIPAA in the US, that's non-negotiable. You need strong encryption, clear policies on how data is used. Basically, you have to build and maintain patient trust. Without that, none of this works.
Absolutely. Trust is fundamental when it comes to health data.
So putting it all together, these intelligent systems really do have the potential to transform healthcare. We're looking at care that's potentially more efficient, more personalized, and ultimately more accessible to everyone.
And maybe here's the really interesting thought to leave everyone with. Think about this. How might these systems soon give you the tools and the insights to take a much more active, informed role in your own health journey? That could fundamentally change our whole relationship with healthcare in the future.